When you look around in Ethiopia, the healthcare facilities are very minimal. Like we decided to build this facility in Arsii Negele because they have no healthcare facility, hospitals around here. They have nowhere to go. So we decided maybe if we did build a hospital in Arsii Negele, it will serve the area here.
You see all this trash down there? All of the land here, all of it was a trash like that, except they were dumping all the dead things in here. When you pass by here, it stunk so bad. The city avoided walking within any parameter of this property. And I asked them, why does it stink? They said, well, the owner just decided to leave it that way. And I told them, in fact, they were trying to show me a different land to give me for a hospital site. And I said, who's the owner? They said, I don't know. The lady lives in Addis, but she owns it. So I said, I have to clean this land. I want it.
Okay, Dr. Strom, you had a chance to meet with our construction guys and some workers. What did you think about the work that's going on here and some of the kids that were actually working here?
This is really an amazing project that's going on to see a new hospital coming up in the center of town of Arsii Negele in what was a trash area that Dr. Gudata has helped to transform to care for the people here in Arsi. It's going to cover a population of 70,000 people and about 10 kilometers radius from around this site to bring them much needed healthcare services that have been a huge gap up until this point, or up until the hospital is finished. Very, very exciting, and the dedication and commitment. Many of the workers that you see, the young women and some of the young men carrying the stones to support the foundation, are students at the local secondary school working for their summer vacation to make some money for their clothes and their books for school next year. Some will stay here in Arsii Negele, others may have opportunities to move on elsewhere. And hopefully maybe another Gudata Hinika will arise from this group.
That's wonderful.
It's absolutely incredible to come to this building now, nearing completion, when less than 3 years ago we were standing downstairs on an open foundation with sticks to support, cinder block, and cement. Unbelievable to see the change and the transformation this has already created. The mud road that ran in front of the hospital is now a cobblestone street. When we came, there were children who were gathering drinking water from mud puddles in that road. A woman who was washing her clothes in another puddle. Just hard to fathom the kinds of change that this hospital is bringing already to the area. This is going to serve a catchment area of nearly 1 million people or more under Dr. Hinika's vision. And he has this incredible facility with OR capacity, delivery room capacity, an extensive outpatient department, and the capability of really serving the majority of the needs of people throughout this very area. Congratulations, Dr. Hinika.
Planted.
Beautiful.
This is going to be completely greenery. In fact, when you walk through here, around the park is going to be grown up, but the whole area should be just really nice. We're going to have a water fountain in a circle there.
You should pipe this so that the water comes out in the branches. So it's like, you know, falling, instead of leaves falling, it's water falling. And then it will be pretty if your leaves are not so thick, so the water will fall from different parts of the leaves. So you'll have like a cascade of, it's like rain. It's not all like a shower, right? So you'll have different levels of drops. And then, so you've got this guy here, right? This is your tree. I know, it's kind of stupid tree. But then here you'll have the reflect. So we'll have you'll have to build, whoever's building the structure, you'll have to build like a slope. Because what's gonna happen is like it's like a slide. So when the water comes down, just very slightly, when the water comes down this way, it'll almost be like a little waterfall.
So the cafeteria is going to be at the end of this. Actually, it's going to be a conference center and nice cafeteria where people can come from outside and eat and relax and refresh. But that's kind of room now. Actually, the school is going to be right here. They're going to start building college, 2-story. But I'm to Honano. So they're going to build the college 2-story right here. In fact, it should start in the next week or so. And it should actually, our goal is to start the medical college as well as a hospital at the same time. And right at the end of here is going to be a cafeteria with the conference center on top of it. So that means the greenery here, as you walk this way, you will have a greenery on both sides. It just need to look like a lush. When people come in here, they need to feel a presence of something unique. It's going to be a place where patient can come, sit under the tree, beautiful shade. 5 trees with 8 chairs around it. See again? If you realize all this greenery back here, see, this is really where I want the patient to step out when it's too stuffy in there, when it's too stressful in there. It's better to step out. And it says in the Bible, when we're all stuffed up, it's because we're looking away from the cross. So back here, all of healing garden is what we're going to call it. The healing really comes when you
See the cross, yeah.
Right now, we're staying at the front of the hospital, the entrance, and we're going to do a walkthrough room by room. So we're going to go through the lobby, we got the reception area perspective, and then we're going to go to the emergency room.
Doors are going to be right here, right, Norm?
Correct.
So the doors are going to be right here. We're going to walk through, and then to
your right is the reception, which is so important because it'll be facing people when they come in, the patients. We're going to put a center chandelier in the entry here. There's 4 lights. Didn't figure that was bad enough, so to make it more.
this is where the patients and family members will be waiting. Facing them is the reception area, so that the receptionist or the welcoming team has a good sense of how many people are coming in, who's coming in, and what they're. Down the hallway here is where we're going to start. It will be our emergency department.
Dr. Cutter is standing in the reception area. Now, they've really thought about this. There was a window here, and Dr. Hinika says, well, why should the window face the hallway? We got the ambulance pulling up right here.
From what I understand from Dr. Hinika's vision is this could be used as a minor OR and also for a trauma OR, so that patients who come in who are critical, they could get the stabilizing surgery here. But then when it's not being used for that purpose, people who come in with small things such as an abscess that just needs to have an incision and drainage, or for people who have lacerations that need to be sutured, all of those things can be done in this setting. So it's just a great sterile area that has many purposes.
Okay. So this is trauma room, also known as the
A trauma bay.
Trauma bay.
Where you have patients who are critical. Someone comes in, maybe either been hit by a vehicle, or maybe it's someone who, has fallen, some type of injury, or maybe somebody is just very ill and they're unstable. So this is an area where you have a lot of extra equipment and supplies. You have chest tubes. You have, there's a way to intubate them, give them a breathing tube, all the interventions to be life-saving. But it's a pivotal room because this is the anchor, and depending on how the patient's doing, they'll either go to the OR, they'll go to imaging, or they'll go right upstairs. And so so the ambulance would back in, unload a gurney into this area. If this is a patient that's critical, they would rush them past triage into the emergency department ward area. There, they would attach them to monitors and care for them. When the patient stabilized, they would then transport the patient across this area to this newly created landing and in through the hallway to get to the imaging area. Patients who were on the ward upstairs could come down through the graded ramp and go across this same area and down the hallway for imaging as well. So a control room in an x-ray suite is for the techs to stay, and they line the patient up in the x-ray area, and then they go to the control room for protection. So this is all protection from radiation so that the techs don't get exposed on every single exam. So it's protection for them. There's also usually, some device there in order to control the equipment, computer, etc.
Well, in a laboratory, you actually have chemistry, CBC, HIV, all these tests that you do, you need a different location, different workstations. This is one workstation. You need a second workstation also.
Well, the wonderful thing about these stairs is that they're very wide, and so they'll accommodate a lot of traffic, and it'll accommodate traffic very safely. So those who are going up the stairs can stay on the right, and those coming down the stairs can stay on the left of the stair. So
the other thing that Dr. Hinika had mentioned to me was that these are rehab, they're called rehab steps. So you don't have to take very big steps from one step to the next. So if the patient is not doing too well, it's not too much stress on their body.
that's true, and the other benefit about the way the hospital is designed is there's the wonderful slow graded ramp system at the end of the hospital where the trauma and the emergency department days are. So it's a wonderful design for upward and downward mobility in the hospital.
Yes.
That's going to be the line.
So we're pushing the gurney up the ramp.
This is hard work, right?
Yeah, we don't have that big of a grade. You can have it. Take a breath. Okay.
This is good cardio.
This is hard. Oh my God, I'm exhausted.
Well, down the hallway here, we've got OR1 and OR2. And Dr. Cutter will tell us what takes place in this area.
Well, one of the most important parts of an OR suite is the area where we scrub. We have to have, our hands clean and be ready to be gowned and gloved once we enter the room. So, being that this is an OR suite, it's possible that the scrubbing area is here, or maybe it's just outside the door. In the room itself, it's set up so that there's an area for the anesthesiologist to work. Typically, that's just inside the door, and the anesthesiologist will typically work here. And then the place where the patient is made for the surgery is typically extends out from that area. And then around the perimeter, there will be storage and the equipment. And typically, the nurse's area is just within the doorway, opposite the table, the operating table. So that's the typical setup. And again, there's windows in here, which provides a wonderful benefit of natural light to also decrease the power costs as well as providing a nice work environment. The size of this room is fantastic. The one thing about an operating room is you have a lot of equipment. A lot of the equipment is very cumbersome. So you do need adequate doorways, you need adequate space to move things around. The anesthesiologists themselves has a very large device with monitors and things like that. So they need their own zone, and that's designed very nicely at the front of the room. But then where the patient area is, not only do you need the table where you're operating, but then you have a lot of towers of equipment and movable items you need to put in here. And then there's some equipment that's very large, like something called a C-arm, is what we use for real-time imaging for certain types of procedures, bringing that in and out, you do need a good clearance between the table and the walls in order to fit that type of equipment as well. So this is an excellent size for the operating room.
So as we walk through this area, so this whole thing is now a sterile area. And this is going to be the wash areas for the doctors.
And the efficiency of this is that you can then use this washing area for both sides if you choose. There's a central hallway here that allows you to get to both of the operating rooms, both scrubbing areas, and both storage areas. So it's really a very well thought out design in order to maintain proper sterile technique and proper sterile environment. The area that is divided from the rest of the hospital, we call it a sterile core. In other words, it's an area where you have to have on scrubs, you have to have on proper head covering, and in some cases proper shoe covering, so that the area doesn't get contaminated even though it's already in a sterile packaging. So it's a sterile core.
So this is the sterile core that connects both ORs to each other.
Correct.
So if you were, for instance, doing a double case, so that you could see one patient and the other, you would run from one OR to the next.
Exactly, and so what you could do is once you finish in the case and make sure that the patient awakens appropriately and is transferred to the recovery area, you could then walk through the suite area, take a look at the next patient before they're put to sleep, and then you could come back, scrub here, and then re-enter the room in order to be gowned and gloved and then to drape the patient.
So by the time you get into this room, you're already cleaned up and scrubbed and ready for action.
The patient, it allows their experience to be less chaotic, and it's important to have a less chaotic environment in the operating room. It also allows their procedure to start on time, to end on time, for them to have adequate transport to the next area. So it makes the workflow better for the patient, and not only the patient but also the family that's waiting anxiously for the results. So it's really a well thought out design on a lot of different levels for not only the people who are working but also the patient and their family.
Yeah, so the final outcome really makes a difference.
It doesn't.
This is the medical ICU. We're now in the medical ICU. How many beds?
6 beds.
6 beds in the medical ICU.
Going to be OB across and peds on this side.
And so a newborn baby will be rooming in with
Their mom.
So what's really cool about this suite is that IMAC is actually providing us with the e-learning suite.
That's amazing.
Equipment, the electronics, the ability to broadcast and take in video. So
Perfect.
why would it be so important for a place like this, do you think?
You know, whenever you have a hospital and you have physicians and staff, you always want to keep them educated. And everyone is responsible for doing what's called continuing medical education. So what people typically do is they bring in speakers to speak, but there's a cost associated with that. So what this allows is for you to bring in people from all over the world, some of the top people, without having to bring them in from a travel standpoint. So the education will be unparalleled because they have this capability electronically. So this is a wonderful idea. It makes a lot of sense.
So global is local.
Yes, global is local.
Perfect.
It's clear that there is so much thought put into the patient experience, and you really can't beat that in terms of patient care. And then there was also a lot of thought to the staff and the physicians that come here to work. And it has truly been a pleasure to work with Norm, who is an expert in his field and really a great educator, and also our producer, Katina.
But you know, I think it would have not been possible without you walking us through what it feels like from a staff perspective and from a patient perspective, because really that's what we're here to do, is provide the best experience for our patients and also for the doctors who care for them.
I can just say that this is impressive that Dr. Hinika was able to really create this type of facility in a remote area such as this. And the creation of this facility has completely transformed this region. it's impressive. And seeing the growth of the region and the level of sophistication that's coming here is going to change the lives of the people in this area forever.
Thank you so much.